98,000 people die every year from medical errors, making it the fourth leading cause of death in the United States. The Josie King Foundation's mission is to prevent others from dying or being harmed by medical errors. By uniting healthcare providers and consumers and funding innovative safety programs, we hope to create a culture of patient safety together. Now let's take a closer look at Josie King's story. Is that okay?
Josie had brown eyes and brown hair. She had just learned how to jump on a trampoline with her siblings and to say, "I love you," before tragedy struck. In February of 2001, 18-month-old Josie King was admitted to the Johns Hopkins Child Center ICU with second-degree scald burns from a bathtub accident. As a part of Josie's treatment, she was ordered to be NPO or nothing by mouth. 2 weeks later, because Josie's recovery was going so well, she was transferred to an intermediate care unit. After this transfer, Sorrel, Josie's mother, noticed Josie was very thirsty but was told not to allow her to drink. Later, Sorrel saw Josie's eyes rolling back and asked the nurse to summon a doctor. She was reassured by the nurses that everything was fine. The next morning, Sorrel demanded a doctor. The medical team arrived and administered a pain reliever. At Sorrel's request, Josie was okayed for liquids by mouth. Josie perked up after downing a liter of juice. Early that same afternoon, Josie was given an injection of methadone, authorized by a different physician. Josie's heart stopped, and she was rushed to intensive care. Josie suffered irreversible brain damage. She died on February 22, 2001, of dehydration and misuse of narcotics.
Josie King ultimately died from severe dehydration related to the burns that covered nearly 60% of her body. Josie's burns is thought to be second to third degree burn, which includes damage that penetrates all the layers of the skin. Extensive burns like Josie's often require large amounts of IV fluids. The specific amount of fluid differs upon hospital's protocol and the severity of the burn. When a burn happens, a portion of the skin becomes necrotic. Acute inflammatory response occurs, causing there to be an increase in capillary permeability. This gives rise to the massive loss of fluids and electrolytes, leading to dehydration. Common signs and symptoms of dehydration include dry mouth, sweating may stop, eyes stop making tears, nausea and vomiting, weakness, and decreased urine output. These signs should be assessed frequently in burn victims due to the increased risk of dehydration. In this situation, assessments were not competent, leading to missed signs of dehydration. In infants, assessing the suck mechanism is crucial during assessment of burn patients. Josie attempted to reach for any water in sight and sucked on the washcloth when she was being bathed. These signs, unfortunately, were not noted and were determined to be normal by 2 different nurses.
Josie King suffered from a breakdown in communication. After being transferred from the ICU, she remained NPO with no IV access. Therefore, she was receiving no fluids. She displayed several symptoms of dehydration, all of which her mother noticed. Her mother expressed her concern to the healthcare team, who said Josie was fine. The nurses did not pass on her concerns to the doctor. Mrs. King was never told why her daughter was not allowed to drink. Did someone simply forget to change her status in the chart? On the last day of her life, the doctor finally allowed Josie to drink. He also discontinued her pain medication. However, this was not charted, nor passed on to the night shift nurse. A second doctor ordered an injection of methadone. Combined with her dehydration, the pain medication sent Josie into cardiac arrest. If Josie had received fluids, IV or oral, after leaving the ICU, she would probably still be alive. Had the healthcare team better communicated with one another, she may still be alive. In the words of Josie's mother, when you're going to the hospital, you've got to trust and have faith in those doctors. But with that in mind, we've got to write stuff down. We've got to pay attention. We've got to be organized. We cannot be afraid to speak up and ask questions. Essentially, Josie's healthcare team failed to communicate and listen to the patient and her family.
Lack of communication was clearly a detrimental factor in Josie King's case. A current evidence-based practice that improves communication, involves the patient's family, and increases patient safety is a bedside shift reporting. Bedside shift reporting invites the patient and family to be involved and gives them the opportunity to hear what has occurred throughout the shift, the next steps of care, and it also gives them the opportunity to ask questions and provide input. If Sorrel King had the opportunity to hear exactly what was going on in her daughter's care, especially regarding the order for no narcotics, and voice her opinion about getting her something to drink in this type of setting, I believe Josie's outcome would have been different. Effective communication between patients, families, and the entire hospital staff is a key component to the patient's safety and care.
Josie would scream for a drink of water when in sight. While giving Josie a bath with the nurse, she sucked vigorously on a washcloth. Josie was thirsty, but I was told to give her nothing by mouth. These are all statements from Josie's mother, Sorrel King. These are just a few signs of what became to be Josie suffering from clinical dehydration. When Josie was admitted to the PICU, she was said to be NPO and was receiving IV fluids via a central line. Once Josie was moved to the floor from the PICU, her central line was removed, but her NPO status was not changed, so at this point Josie was receiving no fluids at all. This is when Mrs. King began noticing that something was wrong with Josie, even though the doctors and nurses said what Josie was experiencing was normal. If Josie were to have gone to a hospital in Canada, her outcomes would have been different, or could have been different. In Canada, when a child is admitted for severe burns, they are automatically assigned a treatment team that is made up of multiple healthcare professionals along with a burn trauma coordinator and a clinical nutritionist. This group of healthcare providers follows the patient from admission to discharge. The burn trauma coordinator's job is to ensure families' needs are met and their concerns are being addressed. The clinical nutritionist addresses the patient's needs in relation to their current nutritional status and makes recommendations to help improve the current nutritional status at hand. IV therapy, wound care, and vital signs are all monitored routinely to ensure clinical dehydration is not beginning. Intake and output is monitored very thoroughly, and so is the patient's output. A burn patient is never placed on the NPO status. All of these precautions are taken in Canadian hospitals to prevent clinical dehydration from setting in.
There are many different measures that can be taken to assess for clinical dehydration. On initial assessment and the assessments following, the nurse should be looking for signs of prolonged capillary refill, tachycardia, an abnormal skin turgor test, an abnormal respiratory pattern, and most of all, a lack of urinary output. Clinical dehydration scales are based on a combination of physical examination findings, which are ultimately better than individual signs. Along with urinary output, weight change and diarrhea are also signs that clinical dehydration could be taking place. After the basic signs and symptoms have been brought to the healthcare provider's attention, further assessments should be obtained, including a urinalysis for ketones and glucose in DKA. A complete blood count should be obtained for hemoglobin and red blood cell counts because they may increase due to being more concentrated with water loss. If valid information on dehydration still hasn't been found, a kidney function test is the last resort, which includes BUN and creatinine levels that may be elevated due to dehydration. Lab values are vital to a patient's care, and if these measures and use of technology would have taken place, Josie King would still be alive today.
There's plenty of evidence-based practice out about how to treat a patient who is admitted with severe burns, but much of the evidence-based practice is what should be taking place anyway. Like anything in life, there's always someone who doesn't agree with what is being said, and that is exactly what the case is here. Evidence-based practice suggests doing a thorough assessment, including an assessment of dehydration status. But the issue here is so many symptoms can mean so many different things that dehydration can be missed. Evidence-based practice also suggests oral rehydration therapy alongside with minimal IV therapy. The issue here is some believe that oral therapy is useless and slower than IV therapy. There are suggestions for appropriate fluids to prevent GI upset, but some will argue that giving fluids will upset the GI tract. Accurate intake and outputs is another suggestion, but the big problem here is not everyone follows and not everyone remembers to record. And lastly, evidence-based practice suggests monitor output by using a Foley, but the problem here is this increases the patient's risk for getting an infection due to the Foley catheter. Evidence-based practice is key in the healthcare profession, and even though there are issues with each suggestion, these would all have served a quality purpose in saving Josie's life. Josie's story has been shared worldwide, and a foundation has been started in her name by her parents. The goal of the foundation is to prevent medical errors from happening so no one else has to suffer a loss like Josie's family experienced. In Josie's case, there are so many what-ifs, and that's what Mr. and Mrs. King want to ensure no family ever has to question. Josie King was an 18-month-old who was beginning to experience the joys of life, and her joyful life was taking too soon due to a medical error and no one listening to the woman who knew her best.